is Terry Klein speaking. I checked in under my grandson's name, Kai, because that's how I downloaded Zoom meetings. Hope this works.
We can hear you just fine, Terry. Thank you so much. We'll begin in about 1 minute. If you can mute yourself, that would be helpful.
Can you guys hear me? This is Brent Peterson.
Yes, we can hear you, Brent, as well.
Oh, thanks.
Okay, like I said, we'll begin in about 1 minute. I'm just checking to see who else is on the line. And you do not feel the need to let us know. We can kind of see who all is here and whether or not you're muted, and we'll go from there. So just give us another minute to get organized and we'll be ready.
Hi, Colleen. This is Liz Cerise and Patrick and Carol Lucero.
Thank you, Liz. Thank you, Patrick. All right, it looks like we are going to get started. Thank you so much. For those of you who don't know me, my name is Colleen Nielsen. I'm the director of Lake County Public Health Agency, obviously here in Lake County. And the reason we wanted to hold this community meeting is we realized that with the new public health orders that have come out, they're similar to what Governor Polis's orders are as far as being safer at home. We do have some more strict regulations, if you will, in order to protect our community. And so before we kind of get into some of those pieces, if you would like, I would think that we can, I think the big question has been all along from the beginning is testing and where we're at. So I will actually pass this on to Dr. Zwerdlinger. She can introduce herself and maybe talk a little bit about the testing piece.
Hi there, I'm Lisa. Most of you know me as Dr. Lisa. I work at Rocky Mountain Family Practice as well as St. Vincent's General Hospital as their Chief Medical Officer. I wanted to just mention just a little bit about testing and what is available and what we've done thus far. There are two tests that are out there. One is a genetic test that's done through a nasal swab. It tests for presence of the virus in the nasal secretions. The other one is an antibody test that takes a look at the antibody or the body's response to the virus and not necessarily the virus itself. So we've been doing both kinds of testing. The first test we've been doing now for a couple months, the second test a couple weeks. And what we've learned is that certainly COVID is here, as we all know. There are a variety of positive cases that have come in from the genetic test, the virus itself. What we've also learned is that there are some people who have been exposed to the virus who has made an antibody response to the virus. But unfortunately, what we've also learned is that we are very early in our course of infection and that we don't have many people who have been exposed and that we don't have much evidence of illness in Lake County. So we will see many, many, many more infections as the months go by.
Thank you, Lisa. So with that being said, as you can imagine, as public health, we've been looking at the data we've been able to gather. It's taken us a while to be able to open up testing for all. So at this point in time, anyone who needs to get a test or would like to get a test, if you're symptomatic, you would be getting what Lisa was referring to, the RNA test or the genetic test, like most likely a nasal swab. There's also a nasal wash is another way to do that. The other one is the genetic test, which is the antibody test a lot of folks had questions around, and that is a blood draw. And currently, we have the ability to have everyone, either if you're symptomatic, doing one test, and or not symptomatic or thought you might have been exposed, we do have the ability to perform those tests both at Rocky Mountain Family Practice as well as St. Vincent. With that being said, furthermore, when we looked at our public health order and how we could align to what the governor was looking to do, obviously, our intent is to decrease the spread. Really what we're doing is we're buying time for the healthcare system. Not only here, we feel pretty confident in what we can handle, but the healthcare system recognizing that if we had a critical patient here in Lake County, we don't have the ability to treat them and keep them here, right? Everyone here knows we're at altitude. Anything with respiratory, needs to go to a lower altitude. So that means that we have to rely on all of the healthcare systems, both down, on the Front Range, to the south, to the west. And if we overwhelm those systems, and then we in turn now have more folks that are sick in a much higher level, then we may not have the ability to transfer people out. And that's what we're trying to avoid. We're trying to kind of maintain. We know that people will continue to get sick, but we don't want it to be elevated in the sense of, right now there have been questions around the fact that we are having more positives. And the reason is because we now have the ability to test everyone. In the beginning, we only had the ability to test those that were being hospitalized, critically ill, and then known healthcare workers who had exposure. And so now we have the ability to test anyone who has symptoms. So as we kind of go down that pathway and we see what's happening, it's just giving us more information on what we're basing our decisions on. And like Dr. Zwerdlinger said, is that we're just not there yet. Our infection rate is pretty low. We don't want to see that spike. We don't want to all of a sudden have, overwhelming our local system. And then what, like we have a lot of folks down in the Front Range seeing kind of what's happening there. And so we are in contact with counties, adjacent to us, all around us, within different regions, because of the way the state does this, we're not always in the same region as our neighbor, if you will. So for example, a lot of the work that I do in emergency preparedness is with Chaffee, Park, Teller, and El Paso. But obviously, as you can imagine, I have to do work with both Eagle and Summit because of the fact that we recognize that a lot of our population works in that area and or travels into that area for essential services. So that's kind of where we're at. And I am okay with opening up to questions. And Beth, how would you like to do that? So Beth Helmke is our Public Information Officer, who's helped putting this together for us, and she'll kind of help look at the chat, type messages in, and we can go from there.
Thanks, Colleen. Thanks, Dr. Lisa. Yeah, we'd like to open it up to questions, which you can either type into the chat and I can read them out to Colleen and Dr. Lisa to address. You are also able to unmute yourselves. Obviously, we need to do that in a coordinated fashion, so we're not talking over one another. But if you could just, sort of take a pause before you dive in with any questions, that should allow us to address everyone's questions. So go ahead if anyone wants to dive in with something you've been curious about. We'll see if we can't address that.
Hey Beth, this is Kaylee. It looks like Susan Fishman raised her hand. So I don't know if we have to unmute.
Everyone has that ability, but thanks, Kaylee. Susan, if you'll hang tight for just one second, I've got 2 questions that have come in through the chat, and then we will queue you up as the third. So the first question is there any information on the average price for a genetic test and the average price of the antibody test?
Yeah, so for most people, they're free. Most health insurance companies are required now to pay for the cost of the office visit and the test, irrespective of the genetic nasal swab test or the antibody blood test at 100%. If you do not have health insurance and you have a social security number, there is funding now available through the federal government, which will also cover the cost of the test for free as either test and the office visit. If you do not have a social security number, we can do the cost of the test for free. And then the public health department graciously has offered to pay for some of those tests until their funding is no longer available. So for everybody at this very second, testing is completely free.
Thanks, Dr. Lisa. Next question, when do you anticipate public buildings opening, and will Lake County be requiring masks inside all public buildings? And are masks available for those who do not have them?
All right, a 3-parter. Let's see if I can get all of the pieces. So the first piece is currently all of our which one? Oh, no, sorry. I lost the question because I'm trying to cheat and look at the question at the same time so I don't lose it. And so, so public
When do
buildings.
you
So as far as
anticipate, when do you,
I got it, Beth. I'm in. I appreciate it, guys, as we're working
Cool.
through this. But so currently right now for county courthouse, we are looking at May 31st is when we pushed out. So we're looking at a June 1st opening. As far as wearing masks, currently the recommendations that we are looking at as far as what our new normal is the social distancing protocols and practices that we've been talking about for weeks. And what's kind of come into play in the last couple of weeks is kind of addressing that mask piece. And really, it's not necessarily having a mask. We're calling it a face covering. It can be as simple as a bandana, and or as complex as someone actually sewing something and having that. And so at this point in time, we are recommending that anyone in public does wear a face mask. So that would include if you are going to access public buildings. That includes if you're going to be in Safeway. As far as masks being available, like I said, it does not have to be anything fancy. You could use like they call them puffs or like a gaiter and or like I said, a bandana. It doesn't have to be a manufactured mask. And for anyone who
the second part to that is,
yes, if anyone doesn't have that, I know that Lake County Build a Generation is taking, I believe it is a form that you can fill out to request a mask, and I'm not quite sure how that process works. Beth, maybe you could just speak to that.
both on the Lake County Build a Generation Facebook page as well as the COVID-19 information page, they've just put up a form. You can just request the number of masks that are needed for yourself or your family, and then they have staff who are coordinating acquisition and provision of those masks. And you can certainly reach out to Lake County Public Health if you're not able to access their form, and we'll make sure that you get connected.
Thank you, Beth.
Great.
Yes, this is Christy. I just put that link in the chat as well.
Great, thank you, Christy. And we will be compiling a frequently asked questions that will have some of these resources in a singular area, and that'll be distributed after the meeting as well. Great. So I'm going to bounce over to Susan Fishman. She was raising her hand and let her ask a question. Susan, go ahead. Susan, I believe you're unmuted, but I'm not hearing you. All right, Susan, if you maybe can type it into the chat and we will get back to you. I apologize. I'm not able to hear you. All right, Colleen, next question. How many people are allowed in essential businesses such as Safeway or gas stations?
So currently the recommendation is based on the square footage of the store. The key to that is the ability for people to maintain 6 feet apart. So it just varies on the size of the store. Currently it's Safeway. They are currently monitoring people coming in at this point. They do have a certain number of folks that they will allow in the store. I do not have that number offhand. I do know that they have someone at the front door who is counting. And so far, from my understanding, they have not hit the max limit. So I do appreciate that folks are following that 6 foot distance and spacing out and shopping once a week, which decreases the amount of people in the store, if you have to be in there every day. So I say thank you for folks who are able to do that. And so yes, it'd be the same for a gas station. It depends on the square footage. Key is that social distancing piece is to be able to maintain 6 feet.
When businesses open up to the public, will the public be made aware of the protocols for going into a specific store?
So right now, the protocols that we are asking for businesses to follow are pretty straightforward, is whether or not they can have these social distancing parameters in place, that they have the ability for people to move around and be within, or excuse me, to have at least a 6 foot separation. We are requesting that people wear face coverings in public, so in all businesses. They will have that posted on the front door. There will be signage saying that as far as those protocols, but they are universal throughout all of the stores. So currently in public health, we have the ability of all the businesses are turning in what their social distancing protocols are, and then we're reviewing them. We're working with them to make sure that everything's in place as appropriate, and that includes like hand sanitizer and hand washing, depending on what the business is. Every business is a little different.
Thanks, Colleen. Lisa, this one may be for you. Can you elaborate more on herd immunity in Lake County?
Yes, ma'am. Herd immunity is a concept of how to protect ourselves against an infectious illness based upon numbers of people who are infected. So, for example, if there is a 60% immunization rate against measles in a community, the community is considered safe and has herd immunity against that particular illness. The same will go true for really any illness out there. So with COVID-19, if 60% of us are either vaccinated, hopefully one day, or have had the illness and have the antibody, then we are considered a safe community. Our current number is 3.6%, and that data is based upon about 411 tests that have been collected both at St. Vincent's and here over the past 10 days, a week and a half. Obviously that's nowhere close. Unfortunately, if you look at larger centers like New York City, for example, their percent antibody positive test is about 15 to 20%. So even after everything that they went through, they still do not have enough people exposed yet in order to get herd immunity. So without a vaccine, that will take years to get there, but hopefully we'll have a vaccine here soon, within a year, and then that will help significantly towards the concept of herd immunity.
How many people have been tested for antibodies and how many people have tested positive for antibodies?
So as I just said, we've had, and this data is 2 days old, but as of 2 days ago, we had 411 people in Lake County who've been tested, and 3.6% of them have been tested positive.
If I have never had any symptoms of COVID-19, would you still recommend an antibody test?
Yes, for two reasons. One, it is the only way that we're going to be able to safely open up our communities by determining, how many people are exposed and infected. And 50% of people who have been exposed to COVID either have zero symptoms or very mild symptoms that you wouldn't think is, anything other than just a mild illness. So yes, antibody testing is important, and we'll continue to offer antibody testing through the hopefully entire pandemic. And so we would hope to have 200 tests per week, again, in an effort to try and give our elected officials advice on how they should continue to open up our community.
Why not require rather than recommend a face covering?
Because we don't have the ability. It's, so much of what's happening in this pandemic is personal responsibility, is people to make sure that they're taking care of themselves as well as protecting others. And a face covering is how we do that. As you can imagine, not everyone gets on board with things that are absolutely mandated. And so it's highly recommended, with the understanding that not everyone is going to do that. Obviously, I would love if everyone wore a face covering, but we don't have the ability to require everyone to wear a face covering. Do the right thing.
What are the current restrictions for rentals and when the rentals are individual cabins? So this is pertaining to short-term rentals.
Yeah, so currently right now we are not allowing any short-term rentals, hotels, motels, hospitals, and that kind of thing to take on any reservations. We did have that from our first public health order that went out on March 20th with the understanding that they would vacate, I believe it was by the 22nd, which is a Sunday. I'd have to get that date. They are able to take reservations for the workforce that is currently coming into our community, as well as local workers that are living here and working here. So at this point in time, our date to kind of reopen and look at that is June 1st.
What is the current status regarding allowing second homeowners into Lake County? And if they are not allowed, when do you expect this restriction to be lifted?
Kind of like the face coverings, right? We are recommending that second homeowners don't come in unless they have essential services and or maintenance. Obviously, if they're coming in for the summer, we realize that we're coming into that transitional time. We ask that folks do self-quarantine at home and not come out into the public. And if they are, 6 feet face covering. And so at this point in time, what we're really trying to do is to not have a flood of people come into our county and expose us and then increase our infection rate, therefore increasing the need for healthcare services, therefore increasing the burden, across Lake County. And so that's not just pertaining to second homeowners. Obviously, we recognize our second homeowners are truly part of our community. And I know this has been a difficult time in the sense to ask to stay away. But I also recognize that this is a time for a lot of our second homeowners to transition in, but we do ask that folks have the ability to self-quarantine at home. But as the public health order reads, it does say that if you do not have to be here, please don't be here.
So this is the question from Susan, kind of a follow-on to the masks. Are you considering requiring masks?
I don't think we have the bandwidth ever to be able to require masks, because then that would have to be a very strong enforcement piece. We're hoping that people will figure that piece out and protect themselves, because it's not just about protecting yourself, it's also about protecting others. While we do recognize a lot of, this illness, is mild to moderate, but for the folks that it is severe, especially in our vulnerable populations, immunocompromised, our older, generation, that we're trying to protect each other. So this is bigger than just a me, this is a we thing. And so it's very difficult to require something versus, hey, let's recognize why there's a need and let's see if I can do my part. That's kind of right, Governor Polis, let's do our part.
Is it possible to report not only the number of positive cases, but also how many are severe enough to be transferred or hospitalized?
I can answer, or I can start this answer, Lisa, if you would like. So basically what's really hard about our small community is that if we share that someone, has been, hospitalized very quickly, and I think most people can attest to this, they're going to jump to conclusions about who that is. At any given time, we can have 3 to 8 folks in our hospital locally where we do know that we've had COVID-19 patients who are able to be in St. Vincent Hospital and be able to be released from there and not necessarily be transferred. I think that's just a difficult thing to share out, in the sense that people very quickly will want to identify that. And my take home point continually to be is, if you are doing the right thing for yourself, if you are staying 6 feet apart, if you were wearing a face covering in public, if you were avoiding, gathering in less than 10, and if you're doing everything well, then you should be doing really well. And we shouldn't be concerned about some of the other folks or telling on some of the other folks. Like, we have to take personal responsibility and protect ourselves as well as others with our behavior. And that's kind of where I'm at, but I'll let Lisa kind of speak more to the medical piece of it.
Yeah, we just want to respect patient confidentiality, and HIPAA prevents us from sharing specifics of hospitalizations and other confidential medical conditions. And honestly, it doesn't matter. We're all in this together. Some of us will get sick, some of us will not. But it is important that we all continue to be respectful and take care of one another.
And last piece to that question is, I am assuming we have not had any deaths here in Lake County.
We have not.
Okay. Seems like food establishments aren't using masks when preparing and serving takeout or curbside pickup food. Why is that?
That is a great question. If you do have some businesses that you're recognizing these things aren't happening, you have the ability to let public health know. And Jackie Littlepage, if you are on this, which I believe you are, can you let them know what that email is that they can direct those comments to? And if she's not, then I'm trying to remember it. I don't want to give you the wrong one, but you can also call our front desk at 719-486-2413, and we will take a look.
I believe that email address is environmentalhealth@co.lake.co.us.
Yes, that is correct, and I can see that Jackie did put it into the chat. Thank you, Jackie. And Jackie Littlepage, just so you know, is our Director of Environmental Health, and she and another staff member, as well as some other folks, are processing all of our social protocols for businesses currently.
We have been turning people away from our rental cabins, but those people have been saying that other hotels in Leadville are open. Are they? And can we at least open for Memorial Day weekend?
At this point in time, we're not aware of any hotels that are open for tourist traffic. We do know there are multiple hotels as well as some short-term rentals that are housing local workers and or contractors that are coming into our community. As far as I know, once again, if there's something we need to look into, just let us know. And at this point in time, we continue to look at the numbers. We continue to reconsider where we're at. And I totally understand the pressure of Memorial Day weekend. But at this point in time, I'm not comfortable with that. We'll reevaluate here in a week and we'll see where we're at. And obviously you'll be the first to know that, hey, this is what we're looking to do. But at this point in time, right now it's June 1st.
How can we ensure that SiteWise or Excel will not be permitted in our houses when they start up again in the middle of this pandemic? So Excel coming into the community and doing their work, how can we ensure that they're not in individuals' residences?
Yes, currently both SiteWise and Excel, the work that they are currently doing this summer will not require them to enter into a household. They have posted their plans. They have also done, I believe, a community meeting around that. So at this point in time, there's no expectation of anyone to be in their houses. So I'd be very mindful if I were you, in the sense of if someone's introducing themselves and saying they need to get into your house, that is not correct.
So it sounds like Dr. Lisa just said that everyone should get at least the antibody test, correct?
That's what we're recommending, and certainly it is completely up to you when you'd like to get that done. At some point, people will get more than one antibody test. Certainly if you're negative today, doesn't necessarily mean that you'll be negative in a month, and it will continue for us to be, it'll be important for us to continue to gather that data so that we can give information on when people can resume activities.
Is it takeout for food or curbside, and what's the difference?
Good question. I'm trying to formulate that in my head. Some businesses have the ability for you to stay in your car to call and say, I am outside, this is my vehicle, and they bring it to you. So that's curbside. Takeout is when you physically step into their space to receive your food.
So if 80 to 90% of cases are mild and resolve on their own, is there a way for our community to begin to open up in a way that would allow those in the low risk category to resume work and activities while still protecting those more at risk and providing them with appropriate services? Seems that this would help with herd immunity as well as issues such as suicide, domestic violence, etc.
Let me answer the first part of that, Colleen, and then you can take the rest of it. So it's not 80 to 90, it is 50%. And so 50% of the people have mild or no infection. There is a significant death rate associated with this infection. And so what happens is that you overwhelm the medical system. So if it is a free-for-all, we get New York City, which is what happened there, where they didn't have time to implement all of their social distancing and all of the ways that they were able to protect themselves as we've done here. And there were just too many people too quickly, and the hospitals they're just not big enough. There's not enough beds, there's not enough ventilators, there's not enough doctors to take care, nurses to take care of all of those patients. And so if you overwhelm the healthcare system and there are not enough supplies or medical professionals to be able to take care of those patients, some patients will die who would not have otherwise if the healthcare system was not overwhelmed. And that's what we have to avoid. So there are ways to do this. And if you are able to examine the data in Colorado, we've done a great job in Colorado at flattening the curve. And so what's happening right now is very maintainable. We are seeing sick patients. They are coming in at a rate with which we can continue to take care of them, and they have not overwhelmed our healthcare system. So yes, that's what's happening, but it has to continue to happen slowly, because if you open the floodgates and there are too many patients, then people will die who would not have otherwise needed to.
And then I apologize, Beth, I don't know the second part of the question to answer.
Yep. Second part of the question was, seems like this would help with herd immunity as well as issues such as suicide, domestic violence, etc. So, obviously there's a negative component of the extended quarantine occurring in homes.
Yes, absolutely. We totally recognize that in the scheme of it all, and it is a tough situation, but know that there are services available for folks facing those situations to have the ability to talk to someone and kind of work through some of those pieces. Obviously, we have, Solvista, we have advocates, there are other hotlines that we have mentioned. And so it's important that if you are at that place that either it's important during this time is to stay connected. There's a lot of ways to do that you don't have to be physically with someone. So it's about trying to figure out some of those pieces for yourself. And then we will have, all of that information provided. And, we do have it in our weekly update that we send out to the community. And if you're not on that list and you need to be on that list, let's make sure you get all of those resources so that you can find them as you need them. And yes, it is an unfortunate part that we absolutely recognize. And, let's be mindful of our neighbors and let's take care of each other and recognize what's going on. So thank you.
So reinforcing the antibody test, if someone has already had the antibody test and it was negative, when should they retest if they feel that they have been exposed but are still asymptomatic?
That's a great question. Unfortunately, I don't have a great answer. So we know biologically that from the time that you've been exposed to the virus, it takes 14 to 15 days to get the antibody. And so you should wait at least 2 weeks after you've had a substantial exposure. Certainly, if you get sick, then you should be seen sooner. There are things that we can do to help people manage the symptoms of COVID. And certainly, we don't want people to stay at home too long and then it'd be too late for them to have medical attention. So my advice is that if you were negative on the test and you have no symptoms and no known exposures, wait at least a month before you come back. If you have had an exposure to a known COVID patient, someone who's had the nasal swab and has known positivity, and you wait 2 weeks, that would be a good time to come in and get the test. If you are sick, please call us, and we really want to be able to be available to you to give you advice on whether this is something you can still weather at home or whether you need urgent medical attention.
Are we ticketing people not following the protocols that are being put in place?
At this point in time, what we are pushing out is education for people, and we will continue and try to think of creative ways. We are looking to have a meeting with the DA as well as law enforcement on Monday to see if we have to go to that drastic measure. My hope is that we don't have to. My hope is that people will recognize, the risk that they're not only putting themselves in, but the other folks, their family members, their friends, by not adhering to social distancing practices.
Why are you not reporting negative test cases anymore?
I don't believe that we've ever reported negative test cases. I know we were only reporting on positives from the beginning. Oh, nope, I do remember, sorry. I just remembered we were doing, right, because in the beginning when we were gearing up testing, sorry, it's been 6 weeks, but man, it feels like 6 years with everything that's been happening and changing and evolving over the last 6 weeks. That's right, in the beginning we were posting, pending how many tests we've had, but as the amount has grown and we've seen people being tested in other counties, we didn't find that it was a need, it was more positives, but we do have the ability to share, how many negative tests we have to date, if that's helpful. And I believe Lisa did share that out already. I believe she said it was 411 test total with, where are we?
3.6.
Well, it depends on which test. But at this point in time, we do have 21 positive tests. Recognize that most of those are the swab, the RNAs, those are positive tests. There are all different kinds of case definitions. We have more positives through some of our antibody tests because they were what we call epi-linked, which essentially means that it is somebody who had an antibody test that was positive is linked to someone who had the actual RNA, who had active disease. And most of that we're seeing is, within a family unit. So it's, we designate them positive as well because of that fact. So that's why our numbers might be different from the state as well. And I will share that it is confusing. It continues to change. Even Lisa can attest to a conversation we had this morning about, nope, that's how that used to be this, now it's this, in the sense of, what they're calling probable, what they're calling suspect. So there is some confusion around that as well. And I apologize because that continues to be the case, but we can report out on negatives if people feel the need.
And I am reporting the total tests, and so positive and negative, and that report goes out once a week. You know, certainly the public will let us know how they'd like that information disseminated. But what I'm doing is just anyone who wants it to know, I'm putting it out there. Certainly, you know, one of the things that I've asked is if the newspapers want to know, and we could do a weekly COVID update of our community, but we are as transparent as you want us to be.
Has the virus mutated?
Boy, that's the million-dollar question. So there is some interesting studies or some information out of China that yes, the virus has mutated and that there are new subtypes all the time. You have to remember that the coronavirus is a common cold virus, and it's the virus that has, you know, been on the planet as long as we have, and it does change. It mutates frequently. There was a case report that was reported this morning of another distinct coronavirus that was isolated in the United States that actually happened to be a little less dangerous than the current one here. And so, you know, hopefully Mother Nature does us a favor, and the next go around that this virus mutates, it will be less dangerous. But yes, you can expect this virus to change very frequently, as all common cold viruses do.
Are you starting regular patients and COVID patients in the hospital and Dr. Lisa's office and clinics?
I missed the first part of the question. Are we what?
Are you starting regular patients? I'm assuming that's, are you seeing regular patients and COVID patients in the hospital and Dr. Lisa's office and clinics?
Yes, and so both St. Vincent's and Rocky Mountain Family Practice has segregation of sick and well patients, and so there is a well side and there's a sick side. We've also made specific accommodations, so if people want to be seen in their cars, for example, we can see them in their cars as well. They don't even have to walk into the building. So yes, we are separating sick and well.
How effective are face coverings, especially if it's only a scarf or bandana, at stopping the transmission of the virus?
So very effective. And you have to remember that when you wear a face covering, whether it's a surgical mask or, just a homemade mask, what it does is it protects the public. It does not protect the person wearing the mask. And the whole idea is that this virus is spread through droplets. And so anytime you exhale, whether you're coughing, sneezing, or just regularly breathing, you are expelling virus particles on the respiratory secretions that come out of your upper respiratory tract. And so when you wear a face covering of any kind, it gets trapped. Most of it gets trapped in that, and you know, whether it's 50% or 60% depends on the material you're wearing, but it gets trapped in the material of the mask, and that decreases the amount of virus particle that is being put into the environment. So they're very effective. But remember, you're protecting your neighbors, not necessarily yourself.
So Dr. Lisa addressed this. Are you giving the antibody test outside? Are you required to go inside to get it? So it sounds like you can accommodate testing outside if that's something that's a preference.
Absolutely. And we're also, for the most vulnerable, our folks over 65, we're also offering house calls. And so we don't want you to leave your house. And so we'll certainly come to you.
Why did you stop issuing the informative press releases on the Lake County COVID-19 Facebook page? The reports published were very helpful.
I'm unsure on which press releases were helpful or which weren't, in the sense we've had multiple. When we did have a positive case, it was a very short and brief one. And especially in the beginning, we wanted to really emphasize the preventive measures, which we all know. We already talked about social distancing, but also, you know, the good old washing your hand, using hand sanitizer, not going into work sick and all those other things. So I'm unsure if there's specific information that is requested. We can make sure that that information is getting out.
And there has been a lower frequency of the press releases, so it may seem that they're not going out when in fact they have been published to the Facebook page. They just aren't with the frequency that they had been initially. We are also publishing the weekly community briefing that has all of the press releases to date linked within that document. So we are publishing that on Thursdays. You can keep your eyes open for that. And then that has all of the links to updated and aggregated information. So if there's questions, you can always reach out based upon what's in that document as well. So right now, Leadville is only doing takeout for food according to what was posted. If so, would that mean we cannot go inside the building?
At this point in time, in order to pick up your food, you have the ability to step inside the buildings to receive your food. You cannot consume on premises. You have to take your food and go. Obviously, if there's someone already in there, you know, you have to maintain 6 feet distance. So if that means you be outside. And so does that address it? I'm sorry, I apologize. I'm trying to figure out the right way to address that. But no, physically you can step into the buildings. And there are some, you know, restaurants that, you know, you have to order at the counter if you were to walk, you know, down the main street, and you don't necessarily always have to call on the phone.
Is Sugarloafing Campground open?
We are currently working with Sugarloafing to see what they can or can't do in the sense of their social distancing protocol. We recognize that Sugarloafing Campground does have, puts up a lot of our local workers for the summer in their own RVs when they're self-contained. And so we are working with them currently on social distancing protocols and what that looks like.
We operate a visitor center on Forest Service land. Do we need to submit a social distancing protocol application to Lake County Public Health?
It couldn't hurt. How's that? We'd appreciate knowing what your plans are, so that way if there is something that we didn't think of, like you might put something in there that we haven't thought of yet, to be like, oh, that's brilliant, we should share that out. So we would appreciate that. That would be great.
If you have tested positive for antibodies and recovered, why do you still have to wear a mask?
These are great questions. So we have no idea about immunity. So we know that people with most viruses get infected with the virus, they make an antibody response, and then their body has memory to that virus. And so when you are exposed again, and you get infected again, your illness is very mild or non-existent. We don't know about this one. And so, you know, all of us are hopeful that when you are exposed to this virus, that you mount an immune response and that you will not be infected with this particular COVID-19 again. But we don't know that. It's not been around long enough for us to make that determination. The other thing you have to remember is that, you know, unfortunately, this is COVID-19. There will be a COVID-20, a COVID-21, a COVID-22. It will circulate the planet very much like influenza does. And this is here to stay for, you know, a long time. And so you don't have, you're not Superman after you've had the infection or when you have the antibody. And we just don't know if you're going to continue to be at risk for being infected and then infecting others again.
What treatment are you giving for COVID, such as albuterol, oxygen? Are people going home with oxygen?
Yes, and so our treatments for COVID, unfortunately, are very limited, and what we can do is treat people's symptoms. So we can give albuterol, we can give ipratropium bromide, we can do oxygen, and then, of course, you know, for the very ill, we admit them to the hospital. We do not have an FDA-approved treatment, as everyone has seen, we're trying, and so there's lots of experimental stuff going on about giving a convalescent serum. There are also medication that is maybe thought to be helpful, but those are saved for the sickest patients who would die otherwise without those treatments because they are experimental.
How many people that have tested positive so far are now recovered?
Yeah, that's a good question. I'm thinking in my head. So I know all but one have recovered completely thus far.
And then I would also share that the state doesn't necessarily have a definition of recovered, but we do know that people, you know, to Lisa's, what she's sharing, you know, are able to be, you know, home and, you know, functioning again, if you will.
If your child has a fever, at what point do we take them to the hospital? How long do we let the fever last before going to a doctor?
Yeah, that's going to be on a case-by-case basis, and unfortunately, there's not a cookie-cutter answer for everybody. So I would call us. Certainly, our office is open. You can reach us 24/7. The hospital also is open either through the emergency room or through their primary care clinic. And I would call your primary care provider for each individual case because that will vary based upon other symptoms.
Will we need a test for each mutation?
Yeah, that's a good question. Honestly, I don't know the answer to that one either. It depends on how virulent the virus gets. And so, if it mutates back to, just being a simple common cold virus, then probably not. But if it continues to be a significant cause of illness like influenza, then yes, then there would be testing for each individual one.
If your child has to be hospitalized, can you go with them to the hospital so they are not alone?
That's so sad. Yes, it really depends on which hospital. So in St. Vincent's, we certainly allow minors to be accompanied by one adult. But it depends, if your child is in the ICU at Children's Hospital today, the answer is no. So it really just depends on how sick your child is and which hospital you're going to.
How are we handling tourism in county? Fishing, camping, biking, hiking, with all these people coming into town, I think it would be best to mandate masks for everyone going into any public building. Will public restrooms be allowed in all public spaces?
So currently, with the safer at home orders, we're asking Colorado folks to not recreate more than 10 miles away from their house. Obviously, we know people aren't doing that. I think this weekend was a testament to that. And so once again, it's important that you are taking care of yourself and doing what you can to social distance. And as we start opening up, some more of like the hotels and inviting the tourists back in, it's still going to be like the new normal social distancing. And this is a message that's going out across Colorado. So it's not just Lake County's asking for this. This is every county, across Colorado. So people are aware of what social distancing is and what they should be doing. At this point in time, it's still limiting groups to 10 and, obviously 6 feet apart. And I agree with the face covering piece for sure.
SARS was eradicated in 2004. This is similar to SARS. Why wouldn't it have the possibility of being eradicated just like SARS did? How are you sure there will be a COVID 20, 21, 22, et cetera?
So Mother Nature was kind with SARS, and the virus mutated, and it became less infective. So there's always that chance, and I'm certainly hoping for that too. That would be great. I am pretty sure that there will be, COVID's years, because of the way that it's spread around the planet thus far. If you remember, SARS didn't. It stayed in one geographic location mostly, and then when there were cases in other parts of the world, the spread wasn't very significant, and it was nothing like this. Also, the Mediterranean form behaved similarly to SARS, where it was not as infective, and it didn't spread about the planet. So yeah, we can always certainly hope for the best, but I still think that we just need to be realistic and sometimes plan for the worst.
When will the golf course open? It's one of the most socially distant spots there is. Can it just be open to locals so as not to encourage out-of-county visitors?
Yes, so we have been working with the golf course on their social distancing protocol. We have given them the go-ahead to open. It will be up to them in the sense of how they want to introduce public in. And at this point in time, the conversation is to keep it local, if you will. And so obviously they have to do some maintenance on the course. There's still some snow in some areas, but I would check with Mount Massive to see when they are officially open to the public, which would be you guys, locals.
How long will the social distancing and face covering recommendations continue, and what criteria will be used to determine that?
Yeah, I think that's really great. I think this is our new normal. I think this is not going to change going into the fall. There's an expectation that that we will have a spike in the fall, and so as we get to a point where we feel hey, did we hit that 50% herd immunity, and as Lisa pointed out, it takes a couple of years. So I think the question more is when can we be done versus how can we do this well, because if we do this really well, then we can get closer to keeping our numbers flat and getting to a point where we have the ability to kind of loosen up some of those parameters, if you will.
Will you do this meeting again next week?
Yes.
Has Leadville infection rates peaked?
Oh gosh, I wish that were true. No, not even close. Like I said, 3.6% of people have been exposed. So we're nowhere near our peak.
Is Lake County forbidding second homeowners to come in?
No, we are not forbidding second homeowners to come in. We are just strongly recommending if they don't have to be here. Obviously we know if some folks are coming in for maintenance and social services and or transitioning into their summer home, but no, they are not forbidden. As you know, they are a valuable piece of our community and part of our community. And I've recognized once again the difficulty that we've asked of those folks. And so at this point in time, right, you're not forbidden, but if you don't need to be here, please don't be here.
The one thing I have to add about that is that you just have to remember that we have very limited medical resources here. And so if second homeowners live in a big city where there are lots of resources and they get sick, that's one thing. If they come to Lake County and they get sick, it's another thing. And we may not have the resources to take care of those folks. And that's my biggest concern about an influx of people.
So knowing that we haven't yet peaked, do you have an idea or a prediction when Leadville might peak?
Yeah, it depends on how good we are at social distancing. If you look at everyone has to be exposed, everyone has to be infected eventually, and we can do this over, a longer period of time so that our medical system is not overwhelmed, then it will take a long time for us to peak, September, October, November. If we are reckless and open up all bars, we will peak in 6 weeks.
That's the end of the questions in the chat box. Is there anyone who would like to ask a question? Go ahead and unmute yourself or raise your hand and I can unmute you from this side.
I see one more question. Why don't we just get it over with and peak now? Because more people will die. I can't take care of that many people. And if it's a free-for-all and everyone gets infected all at once, then people will die who will not have otherwise because we would have had the resources to take care of them. So, if you do the math, let's think about if 2 people are infected at once, we have 2 ventilators, we take care of 2 ventilated patients and we can get them safely to Denver where they have, the resources there to be able to keep them on the ventilator for weeks. If we have 100 people who are in that particular situation, then we have to choose who lives and who dies, and it's a terrible thing to do, and none of us want to do that. And so it is awful, and I don't like my quarantine like anybody else does, but I do believe that if we are not very careful about how this works, we're going to get into trouble.
Legally, we can't restrict freedom of movement, and discouraging is understandable, but having locals confront out-of-town tourists becomes a slippery slope. How will you make sure this doesn't happen?
That's up to you. Like, we're not asking anyone to confront anyone. I'm asking you to do what you can do to protect yourself and your family. So please don't confront people. Obviously, everyone's, making their own personal choices, including if they're traveling, in and out of town. And so I recognize that's really hard. And like I said, it's a big thing, but the more you can do to protect yourself and your family, the better. And just, having more conflict and more anxiety and everything around that is just not worth it. Do what you can for yourself and your family.
Can we assume school would be closed in the fall, being that we are a small town with few resources?
That's a great question. At this point in time, I don't have a great answer for that at all. Obviously, there's so much hinging on the next couple of weeks because we do recognize that there are some communities that are opening up wider, if you will. Like folks have heard me say, where we're just kind of like cracking the door, we're just taking a peek to see kind of, where we're at and if we can kind of keep the level steady, and then we can kind of gradually continue to open up, different types of businesses. And so I think that's just a tough question at this point in time. And, we'll monitor it. We'll continue to provide information as it becomes available.
If we work in another county that has already peaked, should we try to isolate or quarantine from community areas when in Lake County?
Can you read that question again, Beth? I'm sorry, I didn't get the gist.
If we work in another county that has already peaked, should we try and quarantine ourselves from community areas when we're in Lake County?
Well, I think it's important that regardless of where you are, that you're practicing good social distancing in the sense of, obviously, hopefully that you're working for an employer that's following, who takes care of you, yourself and your safety. So decreasing, if not minimizing, if not no risk to possible exposure, and or when you come back into town that you're following proper social distancing. And obviously, if you're sick, that you are not venturing out, and that goes for anyone regardless, if you're working in a county and or traveling into one of those counties.
If we are social distancing, how can we be sure that Safeway will be safe, and even with out-of-staters coming here and being non-compliant?
That's, as far as Safeway, they have been great partners in all of this. They have done, tremendous measures to ensure the safety of their employees, as well as, the folks coming in. Like I said, they do have someone at the door. They have the ability to wipe down all their carts. They are counting the amount of folks coming in. And once again, I can't speak, of that personal responsibility piece where none of us can control anyone else's actions. We can only control what's within our, environment. And so do your best. Obviously, think about, washing your hands and hand sanitizing, and be very mindful of not touching your face and all those things when you are going through a very large supermarket, and kind of limiting your exposure. And that's also speaking to going to the supermarket once a week if you have that ability. And if you're compromised, if you have the ability in a support system to have someone else shop for you, if you will, to decrease your exposure. And they do, as have, hours as well to, for folks who are, both seniors as well as, anybody else that might be in a vulnerable category on Tuesdays and Thursdays.
Who do we report price gouging to?
Wow, that's a tough one. I'm not sure who is price gouging, and it's unfortunate that that's the route they're taking, but we actually don't have any control or restriction. It's an unfortunate part of the puzzle, right? In any situation, people will take advantage, and hopefully that will change in the future. And if there's something specific that folks need that they feel they don't have access to, they can also put that on the form, and we can see if we can help them out.
And this is just from Commissioner Mudge. Thank you to our Public Health Director and our team at Public Health, and thank you to Dr. Lisa. The Board of County Commissioners fully supports the public health order in effect through May 31st. We all need to do our best to take care of ourselves and each other and plan thoughtfully for the phased process of opening up.
Thank you, Sarah.
If we work in the public, should we distance ourselves from the family that we live with?
Boy, that's been my dilemma for the past several months. There's a couple things to think about. Obviously, most of us don't have separate residents, and so it would be difficult to live somewhere else during this time. Also, our families are so important at providing the emotional support that we need to make it through this, that it would make me very sad not to be able to go home. But there is some advice for healthcare workers about decontamination upon going home. And so making sure, obviously, that you wash, and so you wash your hands the moment you walk in the door. Leave your shoes outside. There's lots of gross things on your shoes, but certainly now more than ever. And then if you have the opportunity to have a mud room or someplace where you can disrobe, put your clothes directly in the washing machine and then jump in the shower. I use soap and water for at least 20 seconds on all surfaces. That has been shown to decrease your infectivity once you arrive home.
Great, that's the end of the questions, and I do want to acknowledge we have about 2 minutes left before we need to move on to our next iteration of this. Also wanted to remind everyone that this will be weekly for the next several weeks, so you can expect, if you're interested in continuing information, to join us next Wednesday at 6 p.m. It'll be the same credentials, but we will post that information through our communications and social media feeds as well.
Yes, I just want to say thank you for everyone, who's on here and getting the information, and then, being able to push that out to your friends and families so that they understand kind of what's happening as well. So thank you so much. Totally appreciate each and every one of you, and please be well.
We are here. Don't ever feel like you're in this alone, because we are certainly here to support and help.
Will there be a recording of these to view at a later time? Yes, there will be. We'll get that posted just as soon as it is downloaded and processed. And as well, we will incorporate the questions into a frequently asked questions document that we are drafting right now and should have the ability to distribute by the end of the week. All right, thanks everyone.
Thank you.
Thank you.